we're going to swiftly move over to Melissa Egan's presentation on the draft National Action Plan on Episodic Disabilities. And Melissa Egan is a member of the Realize team, a team that I truly have the humble honor to lead as the executive director. And Melissa has been working in the field of health and HIV for over 15 years as an educator and facilitator. And Melissa brings a commitment to inclusion, diversity, equity, and accessibility to her work, and has worked extensively with marginalized 2S LGBTQ+ and Indigenous peoples across Turtle Island. Over to you, Melissa.
Thank you so much, Tammy. And thank you to all of the panelists and to everyone here today for their patience and understanding as we move through these really exciting and important topics that we're discussing. It does feel a little strange to switch gears so quickly, but just give me 5 minutes of your time and I will pull us through this. We are going to be doing a consultation on this in April. So please have a look at your emails. We'll send an invitation out to everyone. So I'm just going to give you a brief overview of this National Action Plan on Episodic Disabilities and Employment, but I will be reaching out and seeking folks who are interested in engaging on working on this with me over the coming year. So how did we get here? We started at last year's summit and we hosted a discussion with everyone who was in attendance about what they'd like to see in a national action plan of this kind. And this is what we came up with. The draft document was created using what we were hearing in that discussion. And as we move forward, I will begin to incorporate all of the feedback that we hear in April's discussion. I'm also the Secretariat realizes the Secretariat for the Episodic Disabilities Forum, and they will also be extensively consulted as we continue to develop this. This is the thing that we are kind of hanging the National Action Plan on, our vision. It will guide our work, and we will be seeking feedback on this statement. So have a look at it, see what you think, send me an email if you want to, but definitely try and attend one of our consultations as well. So what we are hoping to do is improve the work lives of people with episodic disabilities through awareness building, accommodation advocacy, and workplace training. It's very simple, as vision statements should be, but this is how we're going to do it. Through mobilizing positive action areas. And we do need to give Elder Valerie some credit for this because Tammy came away from hearing something that you said at a presentation about positive, healthy actions. And we thought, you know what, this is what we're doing. So positive action areas is how we're moving this forward. This is not an organizational strategic plan. This is a collective impact plan of action around episodic disabilities and employment. So what we're trying to do is make sure that this work is grounded by what is realistic and what is achievable. And for us, if it's only one activity a year, that's okay. Moving this work forward and doing it in a way that's possible, manageable, achievable is incredibly important. So the 5 positive action areas we're going to focus on are research. The way we want to do that is by launching a knowledge hub and a resource repository where we will have tools, research, and programming related to episodic disability and employment. We will also work on policy change to increase awareness of how existing policy impacts the lives of people living with episodic disabilities. We will work on education and practice change to increase the knowledge of episodic disability and accommodation in government, among human resource professional organizations, and with workplace leaders through training and education. We will engage the national disability community. So one of those action areas is community. And the last one is advocacy. And this is so that we reduce that stigma of episodic disability and accommodation in the workplace. So these 5 positive action areas are our focus and structure that will inform the way that we move this plan forward in the coming years. Our next step is that consultation. I'm going to be integrating that feedback into the plan and forming working groups, which will be setting goals and activities related to those positive action areas that can identify evaluation, measurement, and accountability mechanisms, which are an incredibly key and important part of this work. I will be providing an update on the work done over the last year at the National Summit on Episodic Disabilities and Employment in 2022, as well as the one in 2023, because if you're not hopeful, then where are you? So we plan to host a summit like this every year, and we will begin to hear regular updates about how this work is going. And that's it. Lastly, I invite you with all of my heart to connect with me, Melissa Egan. And this is my email address. I thank you for your time, for your patience, and for really being part of this incredibly exciting and connected community.
Thank you so much, Melissa. It's really exciting. And I know that so many of the participants of the summit will be coming to the consultation. So it's going to be a rich one, it's going to be an engaging one, and we look forward to that.